Hi, everyone. This is Dr. Michael Wald, and you're listening to the third module of my 13-hour Master's Health and Wellness course. For those of you who are just tuning in and you haven't seen the prior two talks, feel free to go to my website at drmichaelwald.com, and you will find them under the blog section of the website. You can also go to PRN-FM, and they will also have the PowerPoint Zoom presentations there. You can listen either in audio form or you can watch just like this. So for those of you who are new to my show, Ask the Blood Detective, you know that I like to give lots of practical details. I feel that it would not do anyone any good to insult their intelligence by diluting things down. So this presentation today on emotional eating, along with emotional eating and the special way that emotional eating has affected many individuals today all over the world, due to quarantining and all the other special lifestyle measures that we've had to take due to COVID-19, is essential for, well, our health and our happiness. To let me know your thoughts and feelings about this show and to let me know your show ideas, please email me at info@blooddetective.com. And if you want to work with me personally as a patient, that's a possibility. You can call me at 914-552-1442, and my website is drmichaelwald.com. So let's get into it. Before I go any further, when we're dealing with emotional eating, and if you identify after this presentation that you might actually suffer from this issue yourself, I would say to you that it is essential that you are aware of who you're seeing and what their qualifications or lack of their qualifications may be. Now, first I'll say that I'm not a psychologist or a psychiatrist, and those are health professionals that one might certainly consider once you suspect that you have emotional eating issues. But I also work with people over the years in certain capacities, not just regarding their nutrition and what they're eating, but all of that relative to clear emotional eating issues due to my training and my life experience as a life coach and health coach. But in addition to that, I know how to deal with patients from a laboratory perspective and physical examination and other aspects, which help give an entirely, a thorough picture of the emotional eating issues of an individual. So I have a Doctor of Chiropractic degree, and during that time I learned everything from pharmacology to nutrition, essential topics when dealing with anyone with emotional eating issues. I graduated medical school. I have many board certifications as a nutritionist, including being a dietitian, a certified nutrition specialist, double board certified nutrition, and many other qualifications that you can see here on the screen. So when you're shopping around, so to speak, for a health professional to help with the total holistic picture of emotional eating, not just the psychological, which is very important, but there's a oneness between psychology and our chemistry. They're not merely related, they are part of the same thing, and you cannot change one without the other. Any sorts of emotional and mental feelings, thoughts, or processing information requires an emotional connection and also certain biochemical connections there. So very important for you to realize that and to see one or more practitioners who can help you put it all together. Now, this information is for your education only. This is the disclaimer. Any use or misuse of this information is entirely up to you and your responsibility. So let's talk about quarantining and the specialized stressors that have affected all of us at different levels. And if we can identify, if we can distinguish between how we as human beings individually respond to stress, that's the first step toward dismantling stress and emotional eating. So let's go through this list here. So some of the stressors of quarantining: the kids are home all the time, they misbehave, they're being kids. It's stressful nonetheless. There's school, of course, at home, which is an unimaginable, difficult situation for people with little kids. Cleaning the home is either left to the mom or hopefully the mom and family members, including the husband, and there's the dishes and there's the laundry and there's bedtime and all the regular things involved in life on top of the unique and exaggerated stressors of quarantining. Some people share bedrooms due to quarantining, family members sticking together when others are found to be COVID positive, for example, to avoid infection. And our inability to have the connection, the physical connection with people, not being able to hug friends. Some of us ignore this, obviously, but the things I'm saying here are true for many people. A lot of our spontaneousness is just gone because we need to think about where are we going next. Are we going to go to the bank? Okay, fine. Well, I need to bring my mask with me. I need to keep my social distancing. I need to remember to wash my hands, things of that nature. And also delaying visits to healthcare providers because there's a glut of appointments being made. Physicians are being sought out to extremes at this point. My practice, I can tell you, is filled to the brim with individuals, and I only see one person at a time and try to avoid even any other patients in the office at the same time that I see the person who I'm focusing on. So these are stressors. And then, our cleaning of surfaces and knobs and handles everywhere we're going. And again, our working situation, our living situations are highly compromised in these ways and many others. Now, throughout this talk, I'm going to repeat some of these things to really drive home that these stressors are there. Some of them are in our consciousness and some of them are in our unconsciousness. But there is, of course, a oneness between consciousness and unconsciousness. And if we can learn a little bit about that, we could be a lot more effective in terms of dealing with our emotional eating. And all of us have some sort of negative or positive emotional eating going on. Even me, even me. Okay, more quarantining stressors, constantly worrying about gaining weight. I have patients contacting me saying, Dr. Wald, I'm in all the time, I'm doing all these things, I'm doing a lot, but I'm gaining weight. So, part of that is not just because of poor eating habits and lack of exercise. And running around in a small apartment is, unless you're running or walking for an hour or 2 hours, that's not going to matter much in terms of your weight gain. Stress hormones increase during quarantining and in life, and stress hormones do put on weight. And also, as I'll talk about later in more detail, our biochemistry changes to preferring unhealthy foods during times of stress, like proteins from meat and certainly sugar. So let's give a definition of emotional eating, okay? It's defined as the propensity to eat in response to positive and negative emotions. Most of us think of emotional eating as a negatively driven behavior, but it's also positive. For example, if someone's feeling really good, they might want their favorite candy, and that just perpetuates the learned and attached behavior of how one feels to their habits. So whether positive or negative, it's important to be aware of the type or types of emotional eating that you or those around you may have so you can deal with it properly. So the term emotional eating mostly often refers to eating as a means of coping with negative emotions, as I've just said. Also includes eating for positive emotions, such as eating food when celebrating an event or eating to enhance an already good mood, which was the example I just gave. And in situations, emotions are still driven or still driving, I should say, the eating, but not in a negative way. So again, there is positive emotional eating. Now, let's talk about emotional eating and what it means to say that emotional eating is a coping strategy. Well, emotional eating can be considered a form of disordered eating, defined as an increase in food intake in response to negative emotions or positive, and it's considered a maladaptive strategy because it perpetuates itself and can result in using food as a means to cope without actually dealing with the emotional issues that are underscoring why you're emotional eating in the first place. The relief of negative emotions would qualify as a form of emotionally focused coping. Okay, that's a term, emotionally focused coping. That is an attempt to minimize, regulate, and to prevent stress. So that's why people are emotionally eating. On a conscious or unconscious level, they're trying to minimize, regulate, and or prevent or mitigate emotional stress. But it does not work. It may seem to work in the very short term, but it does not. It perpetuates a vicious cycle of bad habits which reinforce themselves. And when I say reinforce themselves, I really mean it. That means that you are being driven by these adaptive, or I should say maladaptive eating habits, and you're not even present. You'll see what I mean in a little bit. So eating disorders and binge eating disorders. Let's talk about that for a minute. To begin with, those that eat as a coping strategy are at especially high risk of developing binge eating disorder. And those with eating disorders are at a higher risk to engage in emotional eating in the first place. So whether you have emotional eating disorder now or not, if you have a history of it, you are at certainly more risk of becoming even worse in terms of your emotional eating behaviors. And those of us who, by some miracle, do not have some disorder of emotional eating, you still need to watch out. So binge eating disorder, that's abbreviated BED or BED, is characterized by frequent and recurrent binge eating episodes associated with negative or positive psychological and social problems. Let's talk about, just briefly, you should be aware that there are a couple of ways in which health professionals can measure slightly more objectively emotional eating. So in a clinical setting, emotional eating is assessed by a couple of different questionnaires and behavioral questionnaires. One's called the Dutch Eating Behavior Questionnaire, which contains a scale for restrained emotional eating and external eating behaviors. And then there's the Eating Motive Scale, which can determine reasons why a person eats tasty foods when they're not even hungry. Subscales including eating for reward enhancement, coping, social, and just social conformity as well. So these are questionnaires that a psychiatrist or psychologist might have you complete to get a more objective sense of where you're at. Now let's talk about mindless eating. I love that term, mindless eating, because it really is true. It reminds me of mindless driving. You know, when you go from one place to another and you say to yourself, how did I get here? You were on complete autopilot while you're driving. So we have lots of examples of being on autopilot in our lives. And one of those big areas is mindless eating. So emotional eating usually occurs when one's attempting to satisfy their drive by eating palatable foods for pleasure in the absence of an energy deficit. Meaning you're not hungry, you don't need the energy, but you're still eating. So emotional eating, that is abbreviated EE, emotional eating, also occurs when one is seeking food as a reward, eating for social reasons such as a party or some gathering, or celebrating something, or eating to conform, which involves eating because friends or family are eating. And that is certainly a very common scenario that I see in my practice. People describe to me all the time that they say, well, Dr. Wald, I was at this event with a family and friends, and I couldn't just not eat. And I said, well, why not? Of course you could. Or there are ways to modify your eating so you get along in that social environment without attracting a lot of attention from all the other mindless eaters. But it is possible. Emotional eating can lead to something called mindless eating. The individual is eating without mindfulness. They are not aware that they're consuming all this food. And this can occur, mindless eating that is, during both positive emotional eating and negative emotional eating. So it's not the stomach. Now, what do I mean by that when we talk about emotional eating? So emotional hunger does not originate from the stomach, such as with a rumbling or growling stomach, which is a trigger for many people to say, I must be hungry. And not every time your stomach rumbles or growls are you hungry, but most of us have connected this. So we've connected feelings with a meaning, which means eating. But emotional hunger tends to start when a person thinks about a craving or wants something specific to eat. And this is where the opportunity to positively intervene is here. Because if we recognize that a person has a feeling and then they exaggerate that feeling by focusing on it and they've made it mean eat, we could make that mean not eat or eating certain things or saying, well, that might mean I eat in 2 hours or an hour. And if we reinforce that meaning, we then develop different neurohormonal and biochemical and neurologic structural changes in our bodies, which allow for a different response. Right now, emotional eating, for any of you suffering from that, you're mostly being driven by your nervous system, which has been emotionally eating most of your life. And like any habit you have, even if it's an athletic habit, a forehand in tennis or playing golf a certain way, or whatever the sport might be, these activities create specific structural changes in the brain and also biochemical changes, which become the new you, which drive you rather than you driving it. We'll get back to that more in a moment. Let's talk about emotional hunger here, the second bullet. So emotional hunger is giving in to a craving or eating because stress can cause feelings of regret, shame, guilt. All of these responses tend to be associated with emotional hunger. So again, the hunger, the craving happens, but then we make it mean something, either consciously or unconsciously, and we find ourselves eating. Now, on the other hand, satisfying physical hunger, you actually need the calories, is giving the body the nutrients or calories it needs to function, and is not associated with negative feelings. So by definition, physical hunger is true hunger, as opposed to emotional hunger, which is not true, which means if you suffer from this, you're literally operating, you're living out of a fantasy, out of a fake construct, which is driving you. Now, if that's not the definition of insanity, I don't know what is. So why do people emotionally eat? There are a couple of theories to be mindful of. Well, individuals engage in emotional eating because they believe overeating alleviates negative feelings. But they find very soon after they eat that they still feel negatively. Here are some theories. First, there's an escape theory in psychology, which means overeating diverts the person's attention, your attention, away from a stimuli that's threatening, so food is the replacement. So people eat to escape reality, is what I'm saying, and that's called escape theory. And then there's restraint theory. So that suggests that overeating is a result of negative emotions among individuals who already restrain their eating. When faced with negative emotions, they cope by emotional eating. Now, the restraint theory supports the idea that individuals with other eating disorders are more likely to engage in emotional eating. Together, these theories suggest that individuals' responses to a threat to the ego increases one's tendency towards emotional eating. To simply put, this theory, any emotional stress can have you develop the habits of emotional eating. This is a picture which shows an area of the brain called the hypothalamus, which is the feeding center, which is one of the areas that literally physically changes structure and chemically changes itself to coincide with the negative emotional eating, but thank goodness also positive strategies to break habits of emotional eating. Let's imagine for a moment that you actually broke the cycle of emotional eating. It doesn't even matter how you did it. If you were then able to examine anatomically and physiologically the structure of the hypothalamus, here shown in this picture that's sort of like an orange color there, the structure would physically have changed. And as long as you perpetuate those behaviors that have caused positive change in the hypothalamus, you will not emotionally eat. Now, this is one of the biggest areas of why and how we're emotionally eating and how emotional eating is perpetuated. And this has to do with the stress involved in emotional eating, not just from quarantining, but I thought I would intermix quarantining in here because we all are experiencing this at this time, but it could be any stressor, even in or out of quarantining. So there's what's known as the biological stress response, which can contribute to the development of emotional eating. So there is a stress response, there are stress hormones. Here's what I mean. So in a crisis, there's a hormone known as corticotropin releasing hormone, abbreviated CRH, and it's secreted by the hypothalamus, that feeding center area I just showed you in the brain. So this CRH hormone is secreted by the hypothalamus, and it suppresses appetite, triggering the release of corticosteroids from the adrenal gland, like ACTH, or adrenal corticotropic hormone. Now, here's the thing to get from all this gobbledygook, okay? The adrenal hormones, they're steroid hormones, they increase appetite, and unlike CRH, the adrenal hormones stay in the bloodstream for a prolonged period of time, and they result in just eating too much, or hypophagia. That's just a fancy term for eating too much. So you're literally being driven through your stress chemistry through the adrenal glands to eat more. This is how stress under quarantining primes emotional eating, but it's also how stress itself primes emotional eating, no matter how or what the situation is. For example, if you were suddenly to find yourself back in the days of the early hominids, and you were in a stressful situation because maybe there was a woolly mammoth, coming at you, your stress hormones would increase, your body would want to eat food to store it up for the long stress run for escapism. So these sorts of behaviors are hardwired in our genetics, but that doesn't mean they cannot be changed and adjusted, because hard genetic changes over the course of even generations can be adjusted depending on what they are, based upon human behaviors. So what is underneath the emotional eating? Why are you emotionally eating in the first place? Well, let's read through these very important 5 bullets here, okay? So for some, emotional eating is a learned behavior. Most of us, it is a learned behavior. And our nervous systems, as I've said, literally, structurally, and chemically adapt to emotional behaviors. Just like, again, if we were talking about earlier, like a forehand in tennis, if you do that enough times, you develop certain areas of the motor centers, which physically, structurally, and physiologically change to accommodate this movement over and over and over and over and over, so that you don't have to think about it. So that's why a tennis player, can you imagine if a tennis player had to think about, well, okay, so how does this forearm or backhand, work in tennis? Well, okay, so I have to bring my arm back here, all the way back, and I want to come up sort of like a sword, and I want to make sure I finish this through. If you had to think about that every time, the ball would be past you, and you would just, it's not a proper way of coping with life. So emotional eating it drives you, but you can trigger it. Bullet number 2. So during childhood, your parents may have given you treats to help you deal with tough situations. I remember when I was tiny, and I remember experiencing quite a lot of stress. There were problems with my parents, and I was, 7, 8 years old. I remember feeling better when I had a glass of milk and an Oreo cookie. So soon I would sneak into the kitchen at night, and I would literally steal cookies and milk. I drank so much milk as a kid, they called me Milky Mike. But no one really knew that was emotional eating. That was a trigger from anxiety in my little brain that looked outside of itself for these placating habits, which obviously don't deal with what's underneath the emotional eating itself. So, as I've said in bullet number 3, over time, the child who reaches for a cookie after getting a bad grade on a test, or there's some stress at home or what have you, wherever else in life, they become an adult eventually that grabs an entire box of cookies because they had a rough day at work, or they got a bad diagnosis from their doctor. So the roots of emotional eating are obviously extremely deep, making the habit extremely challenging to break. But once you identify and admit there's emotional eating, that's the first step. Now, what's important is trying to distinguish your past emotional habits, which, by the way, it is your past that is causing your emotional eating in the present, which gives you certain results in your future. However, those results are negative, and the results are emotional eating. So by distinguishing your past from your present, and your past containing all the origins of your emotional eating, and dismantling them through a process, you can there change your moments, the here and now, and therefore your future is a completely new possibility of no emotional eating or very little emotional eating. Last bullet. Or you may eat in order to conform. For example, individuals may be told you should finish your plate. Certainly I was told that. Most of us were told that. It's usually related to the grandma saying, eat, eat, eat. You have to eat it. There are people starving in Africa. I used to think about that. I was even shown pictures of people starving in Africa, and I was astounded and upset by that, and I made sure I ate what was on my plate. I, however, was blessed with good genetics, and even though I ate more than anyone else at the table, most of my family became overweight and obese, but I didn't. So a little luck there. The education came much later. Eating disorders and emotional eating. So emotional eating is an eating disorder, but it can lead to worse eating disorders, just like pot smoking in some people can lead to harder drug use later on. So emotional eating, it's a precursor to developing eating disorders such as binge eating or bulimia nervosa. The relationship or relationships between emotional eating and other disorders is that they are both related to emotion-focused coping. Maladaptive coping strategies and a strong aversion to negative feelings. So if you have negative feelings and you don't like those and you become desperate really to get rid of them, some of us exercise. That's one of my outlets. I like to run long distances. By the time I do that, I am much more relaxed and I don't have a tendency to want to emotionally eat. And if I do, I've trained myself to eat smoothies with fruits and vegetables and all of that good stuff. So that took time. But look at this bullet again because it's very important. So let me read it to you. The relationship between emotional eating and other disorders is that they're both related to emotion-focused coping. So what is emotion-focused coping? Where your emotions are literally driving you, and you're either in the passenger seat or you might be driving, but you're not holding onto the wheel. So what happens is your body wants to cope, and you simply are focusing on the wrong coping mechanisms, which are eating badly. But if you focus on healthier coping mechanisms, which can't just be healthier choices of foods, that's fine, but you want to develop a strategy in your brain where you're recognizing that, yes, you're emotionally eating, and okay, maybe you've even gone so far as to adjusted your emotional eating to choose healthier things, but you're still in the vicious cycle of emotional eating. So once we adjust your coping strategies and dismantle a lot of the feelings, thoughts, and behaviors from your past, you're free to develop other coping mechanisms which are such that you don't have to eat. You can simply say, okay, these emotions are emotions, and I'm not my emotions, I have emotions. And if you can just separate out your emotions from your actual needs, emotional eating should basically not be present. It sounds simple. Does it sound simple? Maybe it sounds not so simple, but it is part of what's required to break the emotional eating cycle, maladaptive coping strategies. So let's talk about comfort foods for a moment. So stress of different types affects our food preferences. Numerous studies, I couldn't believe how many studies there were, show that physical and emotional distress increase our intake of food high in fats, sugar, or both in the absence of being hungry, which is the definition of emotional eating, eating unhealthy foods without even being hungry. And once you ingest these fat and sugary filled foods, they seem to have a feedback effect that dampens stress responses and stressful emotions. These foods trigger certain neurochemicals in the brain, such as dopamine and opioid release, which make you feel better in the short term. But these hormones, these feeling good hormones, do not stay around very long. So what they do is they cause us to look outside of ourselves to get those hormones high. So we literally become addicted to our own dopamine and opioid release and look for ways to fill that. And that would be negative or positive emotional eating. Let's talk a little bit more about foods and opioid withdrawal. So intermittent access to and consumption of highly palatable foods creates symptoms that resemble opioid withdrawal. Again, these palliative foods are all the bad foods that you can imagine. So they cause us to have more opioids. And then when the foods are not there and the opioid levels drop, we are literally in withdrawal. So what this is suggesting very strongly is that high fat and high sugar foods can become neurologically addictive. So it breaks my heart when people blame themselves for not being strong enough to fight this. This is not something you can most of the time fight your way out of. You have to have a strategy. It is completely possible to end emotional eating. And there is a strategy that is out there for that process to occur. And we're discussing many of those strategies today. This is only an hour talk, so you must realize that there's far more to this topic from a practical perspective. But if you see any suggestion in here that you are an emotional eater, you want to try and break that habit, obviously, with the help of a trained professional. Hopefully both someone in the psychology area, psychiatry area, and the nutrition area. And the people or persons in the nutritional area that you're working with have to know something about the whole psychological aspect of emotional eating. Otherwise, you're connecting specialists and it's just not a coherent attempt. So a few examples of these bad opioid producing foods would be hamburgers, pizza, French fries, sausages, savory pastries, anything that you like that you know is not healthy. The most common food preferences are, from my surveys in decreasing order, are sweet, energy-dense foods, non-sweet, energy-dense foods, then fruits and vegetables. And they contribute to people's stress-induced cravings. So the stress happens, they have these foods, this opioid increase happens, then the decrease happens, then a person runs to these foods, neurologically and structurally your nervous system changes, and you're at the effect like a sheep. You're not even present. And these habits are perpetuated. And that's how we gain all this weight. That's how we get all this heart disease, autoimmune disease, cancer, you name it. This is involved. You should know women are more likely than men to resort to eating as a coping mechanism for stress. At least that's what some of the official line of thought is. As are obese individuals who, with a history of dietary efforts, will obviously have a greater chance of emotionally eating. But in my experience, men and women alike experience emotional eating, and practically every man and woman that I see in my practice has this. So I really don't think it's more women than men, but I thought you would know that in terms of what the literature might say. So let's talk a little bit more about the practical aspect of a stress response and the stress hormones and the vicious cycle that this causes, which literally victimizes you. So high cortisol levels, you know, cortisol, that hormone secreted by the adrenal gland. There used to be some commercials on TV where they showed belly fat associated with high cortisol levels. Well, sometimes elevated cortisol levels are associated with belly fat and overall body fat, but sometimes the cortisol levels go high, you have the belly fat, then the adrenal glands reduce the cortisol secretion because there's only so much cortisol the adrenals can secrete, but you still have the belly fat, but your cortisol levels could be normal. So don't be confused because you've heard that high cortisol levels are associated with weight gain and emotional eating. It is. But sometimes those hormones tank, they become deficient, and you have the problems, or they're in the low or normal area, and you're wondering why you don't match up with it's supposed to be elevated. Everyone with emotional eating should know that there's always a stress response involved, whether it's measurable or not. So in my practice, I always assume the adrenal glands and the entirety of the stress response that involves various levels of stress response that is conditioning your system. So bullet number 1 here says that high cortisol levels in combination with high insulin levels are responsible for stress-induced eating, as high cortisol reactivity is associated with an abnormally increased appetite and for food during stress. Okay, so high insulin levels and high cortisol. I've even heard of some diabetics not taking their insulin to try to avoid gaining even more weight. That is never going to work. Pulling out that hormone, it will not work, and it's not sustainable. Since stress hormones trigger hunger, specifically increasing one's appetite for high-fat foods and high-sugary foods, those whose adrenal glands are more stressed normally are more inclined towards emotional eating, again, abbreviated EE. Now let's talk about some of these adaptive strategies. Bullet number 1, we need to minimize maladaptive coping strategies and maximize adaptive strategies. So that is a strategy. So in order for us to minimize maladaptive coping mechanisms, we have to have those brought to the surface. And that's what a trained life coach or therapist can help you do. And we want to identify, maximize, and develop positive adaptive strategies for you that you can do, that make sense in your life. They may not be the same for other individuals, just like people may have different maladaptive strategies as well. Bullet number 2 here says the relationship between distress tolerance and disordered eating is paramount in terms of its importance. So when a person, for example, has distress, you might think of that as the person is aware, let's say, that they know there's some low-grade stress happening, and that stress may become very obvious stress. But if you can identify it when it's at a lower sort of level, you can then implement positive coping strategies to break that cycle. See, the nervous system is very neuroplastic, which means it's malleable. And you can change that negatively or positively with your coping mechanisms that are both physical, emotional, and biochemical by different and healthier food choices and using nutritional supplements appropriately to more drastically and quickly change your neurochemistry to allow you to have more positive coping strategies. So let's read these very important bullets here. So different coping strategies impact stress tolerance and disordered eating, okay? Individuals who engage in disordered eating often use emotional avoidance strategies. So they're not dealing with the real issues. So they'll eat, and they'll feel horrible. Sometimes they know why. Maybe the day, I just spoke with a patient who was crying during our last appointment, and when I checked in on her, she had said that there's all this stuff going on at work, but today she's having actually a good day. So my first thought is, well, she's lucky because she found herself having a good day, but what about self-generating that good day by identifying those negative causes of emotional eating, dismantling them, making them literally go away, and developing new habits that clean the slate and literally wash your brain of those maladaptive behaviors you picked up in your past, allowing for a clean slate to develop new strategies. It's entirely possible. Bullet number 2, if an individual is faced with strong negative emotions, they might choose to avoid the situation by distracting themselves. So avoidance behavior, just like not dealing with real issues, bullet number 1, clearly perpetuate maladaptive strategies. The title of the slide really should be maladaptive strategies. Bullet number 3, discouraging emotional avoidance is thus an important facet to emotional eating treatment. Instead, you want to distinguish and effectively deal with the cause or causes. If you deal with those causes, then you will not emotionally eat. The most obvious way to limit emotional avoidance, meaning not dealing with stress in your life and then going to eat, is to confront the issue through various techniques like problem solving, actually working on these things, not just saying, oh, my life is hard and accepting that and then somehow justifying your stress. Many individuals, including another woman I spoke with a few days ago, was what happened was her landlord died, and now she was told that she has to move out immediately. And she was crying about not having money and all these other things in her life and how she's trying to make things work and the IRS is doing this and her job is doing that. And I said to her, let's just try for a moment to separate your emotions from what's happening. So I said to her, what's happening right now? And she started getting into that whole story again. I said, stop. I said, what is literally happening? You were asked to move. So you can either move, you can either not move, or you can talk to the new landlord and try to work something out that works. But what happened was she had the trigger of this event trigger all the other stresses in her life, making this such a huge problem that she literally couldn't do a thing. So we had a conversation and she was able to see that all that happened was her landlord died. She was then pretty grateful that she wasn't the one that died after all, and said, right, I just need to do a few things and I'll make the next place even better. So that would be a positive adaptive strategy, not a maladaptive strategy. But she found her way in this emotional morass of feelings and she was completely stopped, as if all of those feelings and all of those emotions were real, and they're simply not. Events may be real, but that's even questionable. But for a moment, let's assume as human beings that some things happen in life and we react to them. Our reactions are not the things, right? Just like we have clothes, but they're not us. We have feelings, but they're not us. We can throw them off and we can reinvent new ones, okay? And everyone deserves to invent new ones. It doesn't matter if you think you're worthless. You can still say, I want a better life. The most obvious way to limit emotional avoidance is to confront the issue, as I said. Last bullet, manage emotional stress. If you manage that, that allows you to cope with situations without resorting to overeating. Now, this woman I just mentioned to you, she was literally eating on the phone with me as she was telling me about her stress. So we need obviously an attitude adjustment. And she didn't even realize she was eating. When I pointed it out to her, there was silence on the phone. She says, I didn't even know I was chewing. All right. Mindfulness technique. This is quite important. First, let's see how we're doing on time here. We've got a lot to cover. Okay, we're good. So one way to combat emotional eating is to employ what's known as mindfulness techniques. So for example, approaching cravings from a non-judgmental inquisitiveness can help differentiate between hunger and emotionally driven cravings. So with the example of the woman I told you about whose landlord died and she had to move, I was able to say during that conversation, and she was able to understand that all of these other stressors are no reflection on her. We all have stressors. And it is an unconscious choice that she has made to have these stressors mean anything in her life. So once she can bring that unconscious to the conscious level, she can then not judge herself and say, stuff happens. And let me invent something that drives me in a positive way, like finding a better place to live. After all, this woman lived with her daughter in the tiniest, maybe 450 square foot space. So almost any other place than this might be better. But of course, it would be even more wonderful if she were appreciative of where she had been, but she had always complained about it. Either way, she has choices now that are free from her past because she distinguished between her emotions and the events, not thinking they were the same thing like that. So one way, again, to manage emotional eating is mindfulness. For example, approaching cravings with a non-judgmental inquisitiveness, as I said. See them out there, make no judgments. If you find yourself making judgments, realize you're making judgments. You can make those judgments, but you don't have to have them dictate how you behave. Just like you might be a prejudiced person in the sense that maybe you think about a person of color or another individual with a different ethnicity a certain way in your brain, but you don't act it out, okay? Our last bullet, an individual may also take the time to note his or her body sensations such as hunger pangs and coinciding emotions like guilt or shame in order to make conscious decisions to avoid emotional eating. So in order to beat emotional eating, in order to control it so it does not control you, is for you to make conscious choices as opposed to the unconscious emotional eating being responsible for having you standing in front of that refrigerator saying, oh my God, how did I get here? We have to bring it to the conscious level. So what are some daily practices that can help us deal with emotional eating? We want to start the day off with a healthy breakfast. If we have a healthy breakfast high in natural proteins, for example, and avoid sugary cereals, baked goods, and focus on whole foods like oatmeal, maybe a hard-boiled egg, maybe a healthy smoothie, maybe some fresh fruit, we're going to set a foundation in our bodies so that we will more we'll be healthier to deal with emotional issues. Because if you're unhealthy and you're sick and also suffering from emotional eating, it's much more difficult to break those cycles. But if you're otherwise physically healthy, you can work on the emotional. Bullet number 2. So make protein, as I said, as part of your diet in the morning. That helps balance out blood sugar levels. It helps maintain lean body mass. It helps build the immune system. It also can give you more energy to get throughout your day. So whether you choose to eat animal proteins or plant proteins, that's a whole different question, obviously. And when I deal with people during my life coaching with them, I obviously adjust the diet around their particular needs in general as a human being, all their physical, mental, emotional issues, and then dealing with emotional eating in terms of what food should they eat and how should they time foods. Let's talk about more of that. So if you can keep your energy up with small, healthier snacks throughout the day. If you do that, you won't have these drops in sugar, which will trigger emotional eating, you see? So you want to drink plenty of water as well, because dehydration can cause fatigue, it can cause headaches, it can cause muscle spasms, it could adversely affect your blood sugar balance, and all of that is going to trigger physiologic events, which many of you out there will be triggered to negative emotional eating behaviors. Chamomile tea is shown to induce calming effects. Melatonin might do that. GABA might do that. Theanine. There's many different things. We want the right nutrients at the right combinations, taken at the right time for the right patient at the right dosing. Not merely, I take that, Dr. Wald. Okay? Not enough. But caffeine drinks would be the opposite. You know, caffeinated foods and drinks like coffee, they stimulate all the adrenal hormones, which we said earlier, stimulates and drives emotional eating. So drinking coffee is like drinking cortisol. Why would we do that? But many of us do that. Look, I like my coffee like the next person, but it doesn't drive me. So you want to determine your nutritional needs in terms of diet, nutritional supplements that match your biochemical individuality. This is a strategy to break the emotional eating cycle. You need to break it emotionally, and you need to break it nutritionally and biochemically. Okay? You can look at my website a bit more at drmichaelwald.com. If you search the search bar on the homepage for the blood detective approach, you'll see how I describe the use of looking at your blood chemistry and other forms of chemistries, maybe in your urine, for example, and other tests, and using those to tailor make a nutritional plan for you. That will change your nutritional biochemistry and even many of your emotional responses right off the bat. Then we can very effectively use your brain power to break emotional eating cycles. Emotional eating and your chemistry. Let me summarize a few points, a few of which I have mentioned already. A visit to a psychologist or psychiatrist or a life coach, along with a certified nutritionist that's a physician or a doctor that has license to read blood work, because it's a key part of breaking the emotional eating cycle and improving your health and well-being in a much faster way. It's actually easier when you bring in the nutritional component of managing emotional behaviors. So we want to watch the consumption of nutritionally deficient harmful foods. We want to identify, first of all, what is a harmful food? So that's something I work out with my patients, because even some of the foods that they might eat that you wouldn't consider harmful may be harmful for them. And then, of course, the developing of coping skills, which include self-evaluation and simple techniques like walking away. So if you find yourself emotionally eating, standing in front of that refrigerator, or sitting there and you're looking at your plate, leaving it, walking away, forcing yourself to leave, having a family member or a loved one or whomever that's in your environment that you've given permission to help you with this, they will say, you need to walk away from that now. Let's go. We're going to go take a walk, or let's go watch this program, or let's go exercise. Okay, or let's focus on something more positively, like doing something good for another person. These are not just good things to do, but if you do them at the time you're in the emotional eating morass, you can start to break that cycle, and your body and your brain literally changes to support that. So some things you just got to tough through. Very similar to desensitization techniques, which in psychiatry and psychology involve, let's say someone has a phobia of elevators. Part of the desensitization technique might be that they are standing in front of an elevator and their heart rate's going and their adrenal hormones are blasting. And then they do that a bunch of times, dozens of times, and they find themselves eventually standing in front of the elevator, but they're okay. Now the elevator door opens, the reactions start again. So you have them do that a dozen times. Then eventually they go into the elevator and they're freaking out. You're with them, the door is staying open, right? And you move through this gradual process where eventually they can ride an elevator. So that desensitization technique involves how these new behaviors make structural and biochemical changes in the brain, which change your behaviors so your body doesn't react in this very stressful way, which, by the way, increases your risk of a heart attack, among other health problems. And then you can say, I'm good, I can do this. That's when you know you've done it right. And in terms of nutritional deficiencies, you want to identify any nutritional deficiencies that might be present, because they can perpetuate poor emotional behavior. Deficiencies of zinc, magnesium, copper, protein, healthy fats, vitamin D deficiency, the elimination of gluten, these are key elements to change brain chemistry. But your chemistry may say that you need other things. So that's why it's important to find out what your biochemical uniqueness is by a healthcare provider that knows how to do that. So I do draw labs and I do nutritionally interpret them. And then I apply that information to that individual with specific emotional, negative emotional eating behaviors. And then we watch those behaviors change. I also sometimes suggest that people test themselves for some stress hormones. Certainly malabsorption testing should be done, because if you malabsorb and you're eating all these things that are good for you and you malabsorb them, you're going to wonder why you're not getting the results to the extent that you thought you would. And then there's electrical testing of the autonomic nervous system. So there is a FDA-approved technology where you can distinguish between how your sympathetic nervous system is working and your parasympathetic nervous system. Those are the two parts of your autonomic nervous system which drive behaviors automatically. And if I identify during this test what we might expect, that your sympathetic nervous system is driving all the cortisol and your emotional eating, then we can develop emotional strategies and also eating and nutritional supplement strategies to break that cycle. The reason I perform the autonomic nervous system test, even though most of the time I know that the person's in a highly sympathetic, stressed state, is because I want to know where that stress state is. So I have a jump on point for the types of nutrients, foods, and behavioral techniques are, because they're different at different stages. And then simply being aware of you eating. Imagining yourself standing outside of yourself, watching yourself through your own eyes, emotionally eating, and imagining that you weren't emotionally eating any longer, the part of you that's watching yourself emotionally eating. And how would you treat yourself? You treat yourself with compassion. You would say something like, it's okay. We're going to deal with this. And there are many positive ways of us doing that. And then putting those into play. So whatever coping strategies are developed between you and your doctors and or your nutritional therapist should be specific for you and should be reinforced accordingly. And you want to figure out what exactly these triggers are. Many of us know what they are. So let's talk about this. So it's vital to recognize the feelings that lead you to food choices. So again, it could be a positive thing where, let's say, well, I'll give you a perfect example of myself. Just about a month ago, maybe 2 months ago, I had to sit for an acupuncture state national board exam test. And it was a 4-hour test with 300 questions. And I studied for about a year for this test, and to the tune of hundreds of hours of study. And I passed this test with flying colors. And the first thing I thought of doing was eating M&Ms with peanuts, because that used to be my go-to food. And I noticed myself doing this. And I said, well, this is very interesting. And I noticed I wasn't even hungry. And I really didn't want the sugar. So I just kind of stood back for a second. I said, isn't that interesting that popped up? And then I said to myself, I'm going to go home and I'm going to have a delicious smoothie filled with nutrition, and I'm going to work out. And that's going to be my positive coping strategy for that particular trigger. There may be triggers different than that, obviously. Many of you know what your triggers might be. Maybe it's the stress of your kids, or you have a bad day at work and you're thinking, well, when I get home, I'm going to eat pizza and I'm going to have a chocolate shake, or I'm going to have, a bunch of coffee and a dessert or whatever it is. So you want to notice these triggers, you want to write them down. And then those are the sorts of things that a talented health coach, life coach, and or a therapist can work with you on. Noticing them and then dismantling them. So we want to identify and label the emotions that make us psychologically hungry. What are those situations? And identifying them. And again, making sure that you have people in your life to help you succeed and to not have unhealthy foods in your house. Don't have things around that undermine your success in breaking your emotional triggers. So that would be an example of changing your environment so that you have the greatest chance of success by just not having bad foods there and having people to help you there if possible, or someone you can call. And maybe, like I have, an entire gym in my home. So if I'm feeling off, I start working out. Now that's become my positive emotional go-to. And as I say here, so as we identify these emotions that make us psychologically hungry, what are those situations? What are the moods? What's the physical environments that may do that cause us to overeat? Stress obviously is a common trigger, but we need to get more detailed in that. What are the stressors? Even boredom, although not considered a stressor per se, can trigger overeating because people don't know what to do with themselves when they find themselves bored. If you find yourself bored, you probably should be working on yourself because life is too exciting and too amazing for you to be bored. And certainly for you to substitute the reasons for your boredom without identifying them and managing them with food. It's so superficial and so brainless or mindless that it is tragic, to say the least. So perhaps for some of you, it's anger or frustration from maybe a fight with your spouse that triggers you, or it could be depression and loneliness, maybe not being connected with family members during COVID, quarantining, or the aggravation of being overweight in the first place, even before all this COVID stuff started. And again, these are just a couple of examples of psychological triggers which trigger emotional eating behaviors. So if you track your triggers that cause you to reach for food when you're not hungry, that's by definition what emotional triggers are. You're not hungry. It's not real hunger. You'll become more aware of the negative outcomes of your choices, and you'll be able to better handle the mood-food connection. So the mood-food connection is certain moods do trigger us to want to eat, and some of us eat specifically unhealthy things. But there's something important in this last bullet I want to point out to you. So let's read it again from the top. If you begin to track your triggers, so you want to track them, you want to write them down, that cause you to reach for food, you'll become more aware of the negative emotions of your choices. So you are identifying your triggers and then why those triggers are triggers for you. And then inventing ways of thinking to say, well, okay, so if I am emotionally eating because I'm stressed out because I just had a fight with my spouse, how can I, and I want to eat badly, how can I manage that trigger? Well, you can have a healing conversation with your spouse. Not, well, they're wrong, screw them, I'm going to eat my stuff. This cycle is very common and leads nowhere, leads absolutely nowhere. So I want to offer you all something for participating today. I will provide you with a 15-minute no-cost phone call. Sometimes we can do it on Zoom. And during that conversation, we can discuss what your health needs are in general. And if you have emotional eating concerns, we can talk a little bit about that, and I can let you know if I'm the best practitioner for you. If I'm not, I always make it my business to find the best people for my patients' needs. But if you are interested in nutritional improvements based on your biochemistry, and if you're interested in unveiling or uncovering a lot of these triggers that might be behind why you choose or unconsciously choose to emotional eat, then that is something I can help you with. So you can call me at this number, which is 914-552-1442, if you want to become a patient. If you're interested in the 15-minute free consultation, first email me at info@blooddetective.com. That's info@blooddetective.com. So I really do hope that this conversation on emotional eating made a difference for you, because it could be a real game changer. Identifying your feelings and then looking into them, it takes work. And many of us put more work and study into our jobs, or you've heard this before, cleaning our cars, than we actually do in working on our emotional well-being. So once again, thank you for your time and listening to this presentation. This is the third of 13 one-hour Master's Health and Nutrition courses. Tell all your friends about it. Please let me know what you think about it as well. And it's been my pleasure to speak with you. Thanks so much, everyone. Be well.